Dr. Mike Ryan, Executive Director
For the second week in a row, there has been a global decline in cases and deaths from COVID-19. There is a huge disconnect growing where in some countries with the highest vaccination rates, there appears to be a mindset that the pandemic is over, while others are experiencing huge waves of infection. The situation in a number of countries continues to be very concerning. The pandemic is a long way far from over, and it will not be over anywhere until it's over everywhere.
19. Dr. Soumya Swaminathan, Chief Scientist.
WHO has been responding to the surge in cases in India and other hotspots. However, demand is currently so high that WHO needs immediate funding in order to sustain its technical and operational support to all countries, especially the most affected, involved in the present wave. In 2020, donors very generously contributed to the Strategic Preparedness and Response Plan. However, in 2021, the current response plan is underfunded, and the vast majority of that is ring-fenced by donors for specific countries or activities. This is constraining WHO's ability to provide an adaptable and scalable response in emerging hotspots.
Dr. Bruce Aylward, Special Advisor.
The surge in cases has compromised global vaccine supply, and there is already a shortfall of 190 million doses to COVAX by the end of June. COVAX works and has so far delivered 65 million doses to 124 countries and economies, but it is dependent on countries and manufacturers honoring their commitment. While we appreciate the work of AstraZeneca, who have been steadily increasing the speed and volume of their deliveries, we need other manufacturers to follow suit. Pfizer has committed to providing 40 million doses of vaccines with COVAX this year, but the majority of this would be in the second half of 2021. We need doses right now and call on them to bring forward deliveries as soon as possible.
Ryan, Director for Immunization, Vaccines and Biology.
Over the weekend, United Nations Secretary General Antonio Guterres warned that the situation in the occupied Palestinian territory and Israel could potentially unleash an uncontainable security and humanitarian crisis. The health situation is also highly concerning, and in the recent escalation of conflict, dozens of incidents involving health workers and health facilities have occurred. Furthermore, COVID-19 testing and vaccination has been severely impacted. This creates health risks for the world as a whole. Protection of health workers and health facilities is an imperative in all circumstances. It's essential that the norms of international humanitarian law be fully respected. In particular, health workers and infrastructure should always be protected, and I call for leaders on all sides to ensure respect for these vital humanitarian laws.
Thanks, Christian. Can you hear me okay?
Very well, go ahead.
Authorization of vaccines for use in children, either adolescents or younger children, does open a pathway for safely protecting children who may have underlying conditions that put them at significant risk of COVID. But I think the important thing is that in the WHO SAGE population prioritization, moving to the immunization of people who are at very low risk of disease is much further down the prioritization list than immunizing those at highest risk of disease. And I think this is the big issue, is that we're at such a different place in some countries where pursuing immunizing people at very low risk for the purpose of trying to interrupt even further transmission, while at the same time there are countries who are still at the beginning of protecting those at the very highest risk of disease. And so I think, as Bruce has said, I think the big message here is it's time to share doses. It's really
Thank you very much. Next question goes to